Makes this symposium unique is that it brings together really patients, advocates, clinicians, researchers, community, and policy leaders in one room. It's a rare opportunity to sit at the table and really discuss the issues as it relates to liver health.
We're learning from us at the bigger health institutions what is going on at the community level, where are we breaking down, and I think that's going to help us bridge some of those gaps in liver cancer screening, build some connections in the community so we can have a better impact on these groups that are most impacted by liver cancer.
It's important for patients to have a voice, for the fact that no one else will stand up for them as much as they will. And if something gets missed, it's the patient that's going to suffer.
We spent a lot of financial and human capital on bringing discoveries to the world, but the people who need it most don't get it. The screening test for liver cancer for patients who are at risk, the uptake of that test, which is AFP and ultrasound, is only about 14% in our community here. So 86% of patients don't get the recommended testing.
Something I'll take away from this is just the fact of being able to understand the long game, how it leads to the cancer. I've known it's been said, but it hasn't been explained until being at the symposium.
For patients, I think it's really unique. They have access to this kind of level of education, and so I'm hoping that'll break down some misconceptions around liver disease and liver cancer, give them more power to advocate for themselves, and they talk to their doctors. It also break down maybe some stigma. That's my hope with the community side, is that they're gonna walk away feeling more empowered and better able to talk with their providers and more likely to seek care.
This symposium really is about turning equity from an aspiration into an action, so that every patient who has liver disease or is at risk of liver disease or liver cancer really gets a fair shot.
If I had to sum up today, I would sit there and say it was enlightening to meet other patients that are new to having a liver disease and seeing how they appreciate the information that they don't have.
This is a very innovative symposium. It's the first of the kind that I've ever attended, and I think it has the opportunity to both educate community and primary care providers on liver disease and barriers to access, and I think that's an amazing thing.